WOCA.
AM 1370.
96.3. 96.3.
Your source for the #1 sports weekends. Fox Sports, only on 96.3 FM, 1370 AM.
Ocala's information station, 1370 WOCA.
Ocala.
All right, 5 minutes after 11 o'clock. Thank you for tuning in. Brittney Marthaller is in the studio. She is with Ocala Health. She's the communications manager over there, and she always brings us great guests. And one of the guests she has brought us in the past is Dr. Grodonoff Nelson, and he's back with us today. He's going to talk to us about colorectal cancer awareness. March is Colorectal Cancer Awareness Month. So good morning, Brittney, and good morning, Dr. Nelson. Good morning to both of you.
Good morning.
Good morning.
Nice day, huh?
Yeah,
Yes.
Nice day for a white wedding. Remember that song? Nice day for a white wedding.
Brittney wasn't born yet.
I know the song.
Oh, okay.
Is that really that old, that song?
I don't know.
I don't know either. Billy Idol. Do you remember Billy Idol?
Yeah.
Do you remember Billy Idol, Doctor? No, not really. Are we so old that new songs aren't new anymore?
Yeah.
Wow. Well, this is a serious topic, and it's a very uncomfortable topic, isn't it? Because it's your butt, basically, you're talking about, right?
Yeah, basically.
So
some patients are comfortable really speaking about it. That's why it's important for physicians to always bring it up.
yeah.
You know, so
I don't know if this is, I don't even know how to ask this question, but how deep do they go looking for those polyp things? I mean, how far in?
they go pretty far into your all the way into your large intestine, your rectum, anus, rectum, sigmoid. Into the
that's a word I don't know.
large colon.
Sigmoid?
Yeah, sigmoid region. So it's difficult to describe because you have to look kind of like an anatomy picture.
But I mean, is it a big long tube?
It's a pretty long tube, but they have to go in there because your intestines are long, so they have.
They're
to
like the
kinda
football field, right? Aren't they?
No.
Oh, not that big?
I mean, where they're looking into is not as
okay,
long as that,
okay.
but it's the whole colon basically that they're.
Do you know what I'm not clear about? So there's a camera on the end of that tube or something. Are there scissors also?
Yeah, in case if they find a polyp.
Oh, so they take it off right away?
Yeah, they take the polyp right out on the spot.
And are you then bleeding? I mean, where they cut it? Is there blood?
There's bleeding. I mean, they cauterize it, they burn that area. So
that little tube has a.
It has those tools there. So
That's
you can maybe stop
amazing.
the bleeding. So
it's got a camera, a scissor, and a cauterizer.
yeah, to go ahead and stop the bleeding in that region.
That is amazing.
That's amazing. Have you ever seen one,
That's
Brittney?
amazing.
These tubes?
Yeah.
Wow.
Did you have it done, or did you just?
No, actually, I was a director of marketing for a gastroenterology practice in prior years. So,
Oh.
yeah, so I'm familiar with it.
So who's the least likely to get one when they should? Men? I guess women have no problem doing these things.
Men and women. I mean, both patients that come in. I mean,
Was that funny?
Some individuals are uncomfortable with the whole idea of having something stuck up there. So
Yeah.
but sometimes it's important to explain to the patient what goes on in the procedure, what to expect.
But you're sleeping, right?
Yeah, they put you kind of in a relaxed state. Most patients that I've seen have it done, they'll go in, be all nervous, and they'll give them kind of the medication to help relax them. Then when they get up, they're like, okay, when are we going to get this done? You're like, well, you're done. And they kind of even forget that they had the procedure.
Oh, really? I've never done this. I don't know if I'd say crazy things if you put a drug in me that made me sleep.
Yeah, I mean, you can, but...
You do? People say crazy things?
Sometimes, though, they get a little loopy. But
I'm videotaping.
But after a while, they relax, and then, they should be fine.
So somebody else be in the room? It's just...
Well, it's the physician and,
Oh, really? Not a friend?
Oh, no. I don't think your friends want to see you get that.
What age? What age is a good age to get this done?
So the American College of Gastroenterologists recommend starting at age 50. And for African Americans, they recommend at least age 45. If, let's say, you have a family member, maybe just prone to getting the...
There's a genetic difference?
Based on studies they see, they make those recommendations. And if you have a family member and they're diagnosed with colon cancer, let's say at the age of 45, they recommend first degree relative to get a colon screening done 10 years prior to
really?
the closest relative that had positive polyps.
So what's the next step so is the polyp then examined to see if it was cancerous?
Yeah, they take a biopsy of it. They'll cut it out. They'll go ahead and examine it to see if in fact if it is cancerous.
So you're not only cutting it, but you're like bagging it and then pulling it out?
Technically, just they pull it out with the
really
with the sniffer.
And how many polyps normally are pulled out?
It depends. Sometimes they'll go in there. Most of the time, they'll go in to do the screening if a colonoscopy is chosen to be done. There's different options on things that could be done when doing screening for colon cancer. But colonoscopy is an option, and it's important to talk to your physician to figure out which option is best for you, which option that you're comfortable with. Because with colonoscopies, there's risk involved. There's risk of bleeding. There's risk of rupture of the colon. Based on studies, 1 in 1,000 cases you'll have a risk of bleeding, risk of bowel rupture because of the procedure.
So when they do the biopsy later on, if they determine that it's cancerous, do they have to go in and do more?
Now, what they recommend is, if let's say they find 1 or 2 polyps, they remove them, they find that they're cancerous. What they recommend is getting a follow-up colonoscopy in 3 to 5 years. If let's say you go in
3 to 5 years.
You're clean, you don't find anything, usually every 10 years they'll recommend getting a colonoscopy.
Are there symptoms?
Symptoms can include, for some patients, sometimes rarely abdominal discomfort, but usually they have bleeding. So if you have blood in your stool, highly recommend that you get evaluated and screened. And that's one of the testing that's done yearly is a fecal occult blood test, or also called a FIT test, where they'll go and they'll take different samples of the stool, examine it to see if there's any blood in the stool sample, and if there is, then they'll probably recommend that you get a colonoscopy. Because what happens is, as you have a bowel movement, the feces will pass over the cancerous lesion, and it'll cause it to bleed, or the polyp, it'll cause it to bleed. Then your stool will be positive for the test. There's different options. There's also DNA testing that's out now, that's relatively new recently. It was approved in 2014, and some patients like that option because it's non-invasive. It's a little weird for some patients, but some patients like it. They'll send you a package. You have a bowel movement. You collect it.
Oh, no wonder it's weird.
And then you send it. Send it via shipping company, UPS, etc. And then they'll get it and they'll examine it. And by examining it, they'll notice. Huh?
So what do you tell the post office when they say, "What's in here"?
Yeah.
Brown, I guess.
It's medical.
Brittney, do you want to take phone calls? Do you want me to take the phone calls?
That's what you're talking
Doctor,
about.
do you want to take phone calls? Okay, we do have a phone call. If you'll put your headset on, you'll be able to hear the caller. And let's go to that call. Can you hear? Let me wait for Brittney to get a headset on.
You're fine. Go ahead.
Can you hear me, doctor? In the headset?
Yes.
Brittney, can you hear me? Good morning. Thank you for calling and for waiting, by the way. You're on the air with Dr. Grodonoff Nelson.
Yes, thank you, and good morning, doctors. If all your life you've gone regular for your checkups, there's no family history, at a certain age, is it possible that you do not have to go anymore for these tests, like if you reach 75 or 80 or whatever?
That's a great question. Actually, most of the colleges recommend that after 75 years of age, you don't really need any screening.
Don't worry about it anymore. You're going to die anyway, right?
The thing is, if some colleges do say if the patient wishes to continue with colonoscopy, usually after 85, there's no need to really get a colonoscopy. The risks outweigh the benefits. Even the screening, after 85, you should be done. You shouldn't.
And it's a very slow. Did you want to speak to the why it's sometimes 10 years if you're clear?
Yeah,
they don't have you come back for 10 years because it's
exactly.
slower?
It's a slow,
it's a very slow one, huh?
process for the polyp to form. And the thing is, we usually recommend patients, and I highly recommend this, diet is super important. A high fiber diet, is very important in keeping you having a less likely chance of developing, a polyp. Because sometimes the diets that
Eat your veggies.
consume, eat your vegetables.
Does spicy
fruits,
food make it worse, or does it contribute to it?
not necessarily.
No.
Spicy foods can cause other issues when it comes to the GI tract, like the stomach, causing you to have increased acidity, things of the sort, worsening reflux disease if you have any. So, but eating well, not consuming too much meat. A lot of Americans are big meat eaters.
I know. Trying to cut back.
Eat high fiber foods, and that'll help.
All right, we'll take a little break and we'll be right back.
The weather is brought to you by myfwc.com. Safe boating is no accident. For this Thursday, times of clouds and sunshine with a high of 79 to 83. Becoming mostly cloudy Thursday night with a shower late. Lows ranging from the mid-50s in the northern part of the zone to 64 in the south. Friday, sunshine returns with highs in the 70s. Saturday, partly sunny, high 75 to 79. From the Florida Weather Center, I'm meteorologist Joe Lundberg.
Hi, I'm Leah Caruso with Strive Rehabilitation, inviting you to join me Thursday at 11 a.m. for Health Matters. Ocala Health and Strive have teamed up to bring you the latest information on good health services available to you right here at home. This vital information will help you make informed decisions about your health. So don't forget to join me here at 11 a.m. Thursday. It's news you can use from Ocala Health, Strive, and your friends here at WOCA.
Hi, I'm Seth with AA Lock, Dock, and Security. Have you ever thought about the locks or security on your house or business? Have you ever wondered why the keys to your new car cost so much? Well, at AA Lock, Dock, and Security, we can help with securing your valuables. We can even replace those expensive transponder keys. We can give you the knowledge that no one else will. Call AA Lock, Dock, and Security at 867-1965. That's 867-1965.
Your weekends are getting a little retooled.
Swear to God, not making a joke.
Check this out. New shows? Check. We are Buzzwords. Some new talent? Check. Let's welcome the guys.
Let's get it going.
Arnie Spanier.
Unbelievable.
TJ Reeves.
This is what you get.
Your weekends are on fire.
Because that's how exotic it is.
We are Buzzwords.
Hospice of Marion County has an urgent need for volunteers to share a conversation with someone, run errands, hold someone's hand. All you need is a willingness to help others. Our volunteers believe the blessings they receive far exceed the services they offer. Will you consider serving, caring, and making a difference? Call today, 873-7441. Hospice of Marion County, making more moments of life possible.
Putting the local back into radio. 24 hours a day, 365 days a year. WOCA News. Variety. Information. Now. Keep your arms and legs on the inside at all times.
All right, 18 minutes after 11 o'clock, Brittney Marthaller is in the studio from Ocala Health, and Dr. Grodonoff Nelson is Brittney's guest. Dr. Nelson is the primary care physician with Family Care Specialists, and we're talking about colorectal cancer awareness. If you have a question, you are invited to call. The number is 622-9622. We've got 12 minutes left. Call early, because if it's a long answer, we won't have time at the end, right? So what is the common question people have? I heard you during the break mentioning that there are alternatives, that if you don't want to do this, but this is the number one recommended way of taking care of the problem, right?
I hate saying it's the number one recommended way, because, I mean, there's different, options out there. That's why every patient is different. Like, for example, if let's say you have a relative with, colon cancer, or if they have like a hereditary disease where they have multiple polyps found, then I'm not gonna go ahead and just say, hey, just get a fecal occult blood testing. You need to get looked at differently than somebody's. Let's say they've been fine, no issues, no real family history, no problems at all. They get the DNA testing done and it comes back negative. Then you don't need to go ahead and proceed any further with getting a colonoscopy. Just get the regular screening, like for the DNA testing every 3 years. If let's say with the fecal occult blood testing or the FIT testing, do that every year. So just keep up with the screening, and I think it's very important. The main goal here today is for people to understand screening is important. Don't just ignore, well, I'm not going to worry about it, because the last thing you want to happen is you develop colon cancer, and then you wish, man, I wish I would have did some screening,
that would be,
to prevent this, because you had, a polyp there or something growing there, and then you just.
But you can't feel it at all, huh?
I'm not necessarily, no. I mean, if it becomes, if it progressively gets worse, you could develop symptoms where you don't have a normal bowel movement. You have what they call pencil thin, stools. You have a massive amount, small to large amount of rectal bleeding. And some patients are like, well, it's just hemorrhoids. Well, sometimes it's just not hemorrhoids. Get looked at. Because sometimes you have patients say, I think I have hemorrhoids, and we go and we look and we don't find any external hemorrhoids. We don't see anything. So sometimes it's something deeper inside, and it's important to get evaluated. You don't want to ignore it, and then it could have been prevented. So the thing about screening with colon cancer, the thing I like is that a lot of times it's preventable. It's preventable.
I don't know if this is a dumb question or not, but is a hemorrhoid similar to what a polyp is? Is it like the same kind of thing?
No, it's different. I mean, the hemorrhoid is, a lot of times, hemorrhoids can be prevented with proper diet. A lot of individuals, they'll strain, with straining with the bowel movement, the tissue kind of comes out of the rectal, anal rectal region, and then you have the hemorrhoid formation. Sometimes they get large. So a lot of times diet helps, again, with the prevention of development of hemorrhoids. Some individuals are just more prone to developing hemorrhoids than others, and external hemorrhoids, because there's external and internal. So, it's not necessarily not the same thing at all. Colon cancer is colon cancer, or polyp formation. There's benign polyps they could have, but I rather know is benign than not know.
Yeah, right.
How about people that have diabetes? Are they more susceptible to polyps because they have to be on medication?
Not necessarily. I mean, it's not necessarily due to the types of medication that you're on, per se. I mean, diet is big, family history is big, and they do note individuals that have a rich diet and fiber are most likely less prone to developing colon cancer. Not impossible, but less prone to developing colon cancer. And the thing I like to really put out there is colon cancer is the more third, biggest cancer disease that's killing a lot of Americans in the U.S. So, so it's important to make sure that you get screened to prevent yourself from having, getting colon cancer.
When we get older, it seems like our skin, the outer skin, gets thinner. Like when you see an old person, this looks like their skin is really tissue. Okay. Does that happen inside of us too? Like, in other words, it sounds almost scary, but if you did the colonoscopy and it was a thin tissue, could it break?
Yeah, I mean, that's one of the risks involved.
That's one of them?
With getting a colonoscopy is the risk of rupture, risk of excessive bleeding. And, like I mentioned, based on the studies, 1 in 1,000 individuals, that can happen. So that's why it's important to speak to your physician and figure out which route, do I want to go. That's why I'm really big on communicating well with your physician.
Right.
If they make a recommendation, ask why. If you can't get an answer, then you need to find somebody that could give you a better answer. And if they do refer you over to a gastroenterologist for, colorectal screening, speak to the gastroenterologist and different options that are out there, what you're comfortable with, risk versus benefits. And they do note that some individuals with certain diseases, like diabetes, and depending on the age, are at higher risk of having, rupture. So it's important to really have that conversation. With any disease state, I just really recommend that you're educated on. It could be from having diabetes, hypertension, whatever it is. Have that conversation. Know what to expect. Know what the risks are involved with everything from type of medications prescribed to what's the best treatment option, and even diet. A lot of times, by changing your life around, making lifestyle modifications, which we're big on, could change the outcome completely with a lot of disease states.
Can a woman who is pregnant have this test done if she fears that she might have colon cancer?
Usually, pregnancy, you really have to be careful about it. I recommend really speaking with your OB-GYN, but if it's for screening, wait till after. It's 9 months. Wait till if there's a risk. For example, if you're pregnant, you find out, my mother, recently was diagnosed at a certain age with colon cancer. I just found this out for whatever reason. Then you could wait after you deliver the child. Then go ahead, because with pregnancy, you really have to be careful, especially with the medications given to relax you and the procedure that's involved.
When the aspirin company advertisements say that it could cause internal bleeding, is that blood the same from the same place? I mean, does it make the walls of our intestines thin or something? What does it do?
So usually when you're getting if you're on a blood thinner for most of these type of procedures, they recommend being off of the blood thinners because if they go ahead and they find a polyp, they cut it. The risk of bleeding.
It could bleed.
Yeah, it goes higher. So that's why it's very important. That's why I say, make sure you're completely honest with the type of medications that you're on, what you're taking. Even if you're taking over-the-counter medications, let the physician know, here's what I'm on, and don't just think, oh well, it's over-the-counter. What harm can it be? I mean, there is a harm with things that you take. So let the physician know what you're on.
We have another phone call. Thank you for calling. Good morning. You're on the air with Dr. Nelson.
Yes, good morning, good morning. You're a retired postal person here, and when we get medical samples through the mail, when people are returning the medical samples, they're in a container that's marked as a medical sample, and when the carrier gets back at the end of the day, the medical samples are all put in a separate container from the rest of the mail.
Oh, okay. Didn't know that.
Okay.
All right, thank you.
Thank you.
Okay, doke. Have a good day.
Yeah, do your samples have to be refrigerated? Do you have to put them with an ice pack in there and then ship
there's
them
a special for like the DNA testing. There's a special packet that comes in. It comes delivered to your home, and it gives great instructions. Like we have the instructions in our office. It gives you great instructions on what to do, how to pack it. It has a little ice pack and everything that it comes with. It even has something where it could preserve the sample, because really what they're looking for is not necessarily blood. They're looking for, because when you have a bowel movement, your skin, or not the skin, but the tissue around it kind of sloughs off, and they test that tissue, and they test to see, based on the DNA sampling, whether you're at higher risk of having the colon cancer. So it's a whole new wave of technology that is great for screening. But it's going to take time for us to see since it's relatively new.
Okay.
And along with how it compares to the other. But so far, I mean, it's great. But same time, too, note that some of these screening tools, if they do become positive, the next step would be getting the colonoscopy done. So.
I think you answered the question. I had a question about DNA testing, because you would think DNA would be the same your whole life long, but it's not really the DNA they're testing, right?
It's the actual, the tissue that's being sloughed off with the
tissue gets sloughed off. I never knew this. Don't you hate when tissue gets sloughed off?
Yeah.
We are almost out of time, so let's give out some contact information. And how do we get a hold of you, Dr. Nelson?
You could call our office if you want to speak to me, set up an appointment to be seen. We're taking new patients. It's 352-351-0120, and we'll be happy to have you. We'll be happy to take care of you.
And where's your office?
It's located on 2300 Southeast 17th Street, Suite 402. It's in the Tealbrook Plaza, and when we're there, we're waiting. And if we could help you in any way, we'll be glad to.
Excellent. And Brittney, mention that phone number again.
Yes, our phone number is 800-530-1188, and also wanted to mention the website for family care specialists is ocalahealthfcs.com.
Oh, okay. And could we call the nurse helpline that you just gave to ask questions about this procedure or anything?
Yes. For non-emergent questions, we have a nurse that will answer any of those that you have.
All right. You going to the Strawberry? We got Strawberry Festival. We got Special Olympics. We got Bike Week.
Yep, on Saturday.
I mean, this is a big weekend, and it's going to be nice. Yes. And if you're out on Friday, we got First Friday Art Walk. Robin's playing mandolin. I'm playing accordion.
Great. Yep, we'll be there.
May not
Artist
be
Alley.
That's awesome.
We're learning Irish songs right now.
Yeah.
That's awesome.
Do you know what's weird about Irish songs? They have this phrase, whack for the daddy-o. It's just like, what does that mean? Whack for the daddy-o. It's like all these songs are whacking for the daddy-o. It must mean something totally different in Ireland.
The daddy-o early in the morning.
Yeah.
I mean, all these songs have this phrase. It's like, what is that?
Crazy, Brittney.
It's fun.
It's crazy. You gotta sing these songs.
Yeah.
Dr. Grodonoff Nelson, thank you so much for coming in here.
Thank you for having me. It's always a pleasure.
And Brittney Marthaller, thank you for bringing us some great guests. Doctor, we love having you in here. We're getting to know you now.
I love being here. It's great.
All right, we'll take a little break. We'll be right back.
Fox News Radio. I'm